Hey everyone, Dr. Charlie Johnson, physical therapist, back here for part 2 of About Me, and I want to share with you a little bit about how I came to specialize in treating people naturally and helping them get back to normal without medications, injections, or surgery. So really I'm I'm advocate for my patients, and I want to help people avoid those things and get back to doing what they love again, with minimal use of those medications and reliance on other people. Okay, I believe that people can heal naturally. So with that being said, if you didn't get to check out my previous video where I chatted a little bit about how and why I became a physical therapist, I share a little of my personal story in there. You can check that out. Otherwise, what I want to start off by saying is that in that last video, I left off with my acceptance into Lebanon Valley College, an accelerated Doctor of Physical Therapy program, which set me up for success. Okay, so once I got through the entry point and I made it into PT school, I became really engrossed in learning as much as I could to help people just like you. You should know that I was always that annoying person in the back of the class, or at work, in the meeting, wherever you can sort of relate to this, who had that final say, who had that final question. So it was me sitting in the back, and I wanted to know why. Well, what I found pretty quickly is that in the academic setting, I could always have those questions answered, right? Teachers were always willing to stay late, and if they weren't, I could email them. Either way, I could always have my questions answered. So that was a really great setting. I really thrived in that, and I was able to, get great mentorship and have a lot of my questions answered. What I realized pretty quickly is that I carried that same kind of concept out into the real world. It was just my personality. I thought, hey, I want to know why I'm doing and what I'm doing. So this way I feel sure about what's going on, and I know that I'm doing the right thing for my patients. So I got into the real world, and I practiced, and I went into healthcare. I went out into the world wanting to change people's lives and really change the world. And what happened is when I went into healthcare and I went into the traditional physical therapy clinic, it was so busy, and there were such strict productivity standards that I was seeing so many people at once. And being somebody who had all these questions, I just couldn't process things quick enough, right? And I saw the same thing, though, with other clinicians, other physical therapists, and just healthcare providers out there who had the same issues. They were seeing a lot of people, and what I saw is that they just weren't thinking anymore. They were going through the motions, offering cookie-cutter treatments, and the results were sort of okay, but I thought they could be better, right? So I went out, and when I found myself having trouble with a case or a patient or something like that, I would ask questions, right? And the issue is that not only were the other people so busy trying to answer their own questions to catch up on their own paperwork, but when they did have free time, they provided me with what I thought, and I wasn't sure, but what I thought, my gut was telling me was like a really poor answer, okay? So I wasn't getting good feedback, I didn't feel I was getting good mentorship, and I really wasn't getting good responses. So I got frustrated with the mentorship, and I actually thought that at some point I was going to quit physical therapy school, okay? Or quit physical therapy altogether, so new career, all right? Or I said, hey, I'm either going to go home, I'm going to quit, or I'm going to go big, and I'm going to go to the best place in the whole world to learn how to do this, okay? So let me backstep for a minute, and let me just say that my ability to help people when I came out of PT school looked something like this. All right, so 50% of people, they came to see me. They came to PT at the clinic I was working with, and they said, PT was okay. I could do most of the exercises, that they showed me at home. I learned some things, but I'm not so sure that it was, a wonderful experience, okay? It was just okay, all right? 25% of the people I actually made worse. Here I was, young and hungry, coming out wanting to help as many people as possible and doing everything I could think of to try to help these people. And sometimes that would mean making people worse, all right? So 25% of people, they came in and they left feeling a little bit worse than when they came in. So obviously, somebody who wants to change the world and is somebody who wanted to help everyone, that was really like a killer, right? So these were the people that kept me up at night. I would think about how can I help these people, right? And often doing more cause more problems, okay? And then I had 25% of the people that I still talk to today that are my raving fans. I changed their life, and they loved everything about what I was doing. Now, again, I came to that breaking point where I said, hey, I want to do more of this. This is okay. Sometimes I get that you can't help everyone. I definitely don't want to make people worse. I want to make people happy, and I want to do the best I can, and I want to feel good about what I'm doing. So I thought at that point when I was frustrated and I couldn't get the answers, and I was in that busy environment where I just wasn't thriving, I wasn't growing, I was getting frustrated and going home feeling bad about what I was doing, I thought, I'm going to quit this. Then, in the back of my head, I thought, man, I gotta stand up for Carla. I gotta stand up for my wife. I got to, I'm good at this. I can prove myself, and maybe I'm just not in the right place. So my wife said, hey, also you have a lot of student loans, so kind of think about this. So I thought, okay, smart girl, and I said, okay, maybe I'm not in the right environment. Let me go to the best place in the whole world to figure out how to do this. So what did I do? Well, what I did is I applied to residency programs. Residency programs are board specialty programs, specialized programs within physical therapy that train you to be great at one aspect of, in this case, physical therapy. And for me, it was orthopedics. So treatment of back pain, knee pain, neck pain, shoulder pain, chronic pain, things like that, okay? Just as, it's the same thing as in medicine. So just as if you had a foot problem, you would go see a podiatrist, or if your child had a problem, you would go see a pediatrician. If you have back pain, you would go see somebody who specializes, like myself, in orthopedics, or neck pain, orthopedics. If your child has a problem and they need physical therapy, go see a pediatric certified specialist, okay? So anyways, what I did is I went into the specialty program. In physical therapy school, you come out with a general doctorate. So you're a jack of all trades, master of none, so to speak. You know a little about a lot. I wanted to learn a lot about a little to really help people in the setting that I was working with, okay? So went out and I applied to 3 residency programs, and I got accepted to the #1 program in the entire country, the University of Southern California. So I moved out to USC with my wife. Long story, I had to come back to get married. In Pennsylvania, you have to be in the state for 3 days before you get married. Long story. Anyway, not good planning, but I was going to do it, and I wanted to go big, okay? So moved out to USC and had a wonderful experience. So I was back in my groove, back in my element of academia and the clinic environment mixed. It was the best of both worlds. At this top-rated program, I did research on shoulder pain and back pain. I worked with spine surgeons, shoulder surgeons, did some work with the Angels, LA Kings, and different professional sports teams. I taught in the physical therapy program. Again, I taught gross anatomy and some different classes on kind of examination and treatment of people with back pain, neck pain, knee pain, things like that. So I was a professor there. I also, in the clinic, we had exams, we had mentorship from other people who are specialized. And then finally, we would have these reviews of all the data and all the evidence out there in these big journals, which don't mean much to you, but it's things that we use to inform how we best treat people. So we learn the most up-to-date treatments for all these different conditions, and we would do that once a week for about 4 hours a night on all the different main kind of body regions for the whole year, okay? So really great experience there. And what was awesome is then I came back, right, and I worked with a clinic again where it was very busy and I couldn't exactly deliver that type of care that I had learned to provide, and I got frustrated again. So then what I did is, here I am now, welcome again, physical therapy in Johnson, where I can deliver that type of care, where now, after going to that #1 rated program, little hair in the face, but for the most part, I can make most people happy. I can offer something to almost everybody, and I treat people exclusively one-on-one, which gives me the best outcomes and people a unique experience. So this type of training places, at USC and through my residency, places my knowledge in the top 0.5% of all physical therapists in the entire country. So it's highly specialized training that we bring to you in a one-on-one setting.